So in this era of 21st century, where beauty is the major concern among the teenagers, not only among the teenagers but also among the adults, so acne plays a major role that affects their social as well as psychological life. So in this video, we will be revealing the etiopathogenesis of acne, as well as I will be giving you the simple prescription that can be practiced among the general physicians. So whenever a patient is coming to you, I generally see the patient, they think that this may be because of some blood impurities. So this is the first myth about acne. People are thinking that this acne is due to their impurities in their blood, but it is actually completely untrue. So what are the pathology behind this acne? So I will be discussing under the 5 headings. The first heading is it occurs due to increase in our one hormone, that is serum androgen. So when there is increase in androgen level, that will lead to acne. Next is when there is increase in sebum gland size, along with that increase in sebum production, which we call it as seborrhea. So sebum hyperplasia and increase in sebaceous gland. Third is when there is accumulation and colonization of the acne causing bacteria. So when you are seeing a case of pustules, then we can also imagine that there can be accumulation of Propionibacterium acne. So in this case, we need to give antibiotics. Fourth is other factors such as diet. When there is food containing increase in high glycemic index. So what are the diet to be avoided, that I will discuss later on. So when there is increase in high glycemic index diet, that will lead to hyperinsulinemia and that will stimulate androgen. So that can cause acne. So all these things that lead to altered process of keratinization, and there is a blockage of pylori canal, that lead to process of inflammation, further inflammation, and that lead to inflammatory acne. Our treatment modalities are mainly based on the types of acne you are encountering. So first we need to divide it in different grades of acne. So there are four grades of acne. First grade, when there is predominantly we see comedones. Along with that, we can also occasionally find some papules. In grade 2 acne, there is predominantly papules, sometimes pustules can be seen also. In grade 3 acne, there is majorly abscess, pustules, and in grade 4 acne, we mostly encounter abscess or cyst and also post acne scarring. So in acne, there are some syndromic associations. There are many syndromes which we need not to know, but you should know the main syndrome that is associated with acne is hair and syndrome, because in your daily to daily practice you can also encounter some cases of hair and syndrome, that is most popularly known as polycystic ovarian syndrome. As if a young female patient is coming to you and she is having increase in weight along with more number of acne which is predominantly present over the chin area, and also we are finding there is also hypotrichosis. So in this case you can also suspect a case of PCOS. So in this case you need to ask the patient whether she is having menstrual irregularity or not. So if all the acne patients are coming to you, as PCOS is very common as you know among the teenagers, so better we should rule out the menstrual irregularity which is found among the patients or not. So in cases of PCOS, we need to do all the hormonal investigations such as serum testosterone level, DHEA level, serum FSH, LH, serum prolactin, and also you need to carry out a test of ultrasound abdomen and pelvis. This test may vary which are the tests you people are carrying out. So that can cost you around one ultrasound that can cost around 750 rupees, or any hormonal assay that will vary what are the tests you are being done. Now come to the major concern, that is what are the treatment you should give as a general physician, because nowadays we are seeing that many patients who are coming to us, they have applied multiple medications over their face while they are encountering a case of acne. Mostly they are in peripheral areas, they are given as steroid, that will mostly aggravate the acne, that will lead to worsening of the acne, and also it is very difficult for us to treat the acne. So what are the treatment modalities you should advise a patient of acne? So in acne we will see we'll divide the treatment modalities into 4 steps. First we need to give the general measures. So what are the general measures to be followed in a case of acne patient? First is diet. What is the diet to be given? So as I have already told, we need to avoid all the high glycemic index foods such as chocolate, dairy products, and those are things to be avoided in case of acne. It is seen in many studies, this high glycemic index food that actually generally increase in serum insulin level, that is hyperinsulinemia, that will stimulate androgen. So it all leads to acne. So the food that we have talked about. Next is, we have to avoid all the heavy cosmetics over face, oil, pomades, and you should always avoid facial when you are having acne, because it will lead to again acne breakout. So now come to the other treatment, that is topical treatment, systemic treatment, and all the physical modalities of treatment. So according to the grade, it will I'll simplify the prescription of your acne. So in grade 1 acne, mostly we are finding a case of comedones or papules. So in this case, retinoids that will act best. So what are the retinoids we can prescribe? So first is tretinoin we can give. So this tretinoin available as gel formulation, lotion formulation. So mostly common prescribed retinoids are 0.05, 0.01 and 0.04. So retinoids, while you are prescribing a case of a patient of acne, retinoids, so in this case there are certain precautions you need to follow, because retinoid mainly cause irritation. So while you are giving a retinoid to a acne patient, first we should start with a low dose and low concentration, and that should be kept for few hours. Then we will ask the patient to wash it after 1 hour, then every 15 then every day we can increase the dose 15 minutes. This retinoids such as tretinoin and adapalene, that can be given around 1 to 2 months depending on the improvement you are noticing in your patients. So the cost will be around in case of adapalene, it will cost you around 250 to 300. So you should always focus on prescribing good brands. So nowadays also some combinations are available. So you can go for adapalene along with benzoyl peroxide, even that will cause that which is having an anti-inflammatory property as well, and also it will prevent your microcomedone formation. Now coming to what is the prescription for your grade 2 acne. So in these cases mostly you are encountering acne in form of papules, pustules. So in these cases better you should go for a antibiotic. So what are the commonly prescribed antibiotics? So in government setup we usually prefer doxycycline, which is freely available at Miramay. So this doxycycline 100 milligram OD, it can be given for 20 to 30 days, and also if you can afford more then you can also go for minocycline, which is more costlier than it, but it is more tolerable. So apart from antibiotic, we can also give a combination of adapalene along with clindamycin. So in this case this will cost you around 250 to 300. So per prescription it will cost you around 2000 per month. So when you are giving a patient with doxycycline, as it is phototoxic, you should never forget to give photoprotection. Along with that, if you are giving adapalene, it will cause you irritation, dryness. So it is better we should prescribe moisturizer along with sunscreen. Now come to the prescription of grade 3 acne, which is actually it can be abscess, cyst, or it can be pustules also. So in this case we need to advise the patient, because in grade 3 acne most of the patient they come to with truncal acne also. So in this cases better to prescribe oral isotretinoin. So what is the dose of oral isotretinoin? It should be given at a dose of 0.5 milligram per kg weight, body weight. It can be given for 3 to 4 months. In our studies it is seen that we have to give it as a dose of 150 milligram per kg. This should be your cumulative dose, because it will consistently accumulate in your blood and it will show you the action. So you have to be very patient, because in some patients it is seen that within 1 month it may aggravate your acne, because grade 3 acne is otherwise called as acne conglobata, because you are seeing more number of pustules, abscess and cysts. So because we are seeing infection, so we have to also give antibiotics. So while you are giving a patient with isotretinoin, you should better avoid doxycycline, because doxycycline and minocycline, they can lead up to pseudotumor cerebri. So in this case we are giving macrolide, that is azithromycin, in a pulse dose. What is pulse dose? It should be given 3 consecutive days a week for 4 weeks, which is of course to be taken before food. Then if you are giving a patient with isotretinoin, so what are the things to be advices to be given to the patients, because as we all know this is a teratogenic drug. So we need to advise the patients to avoid conception 1 month before the starting of the drug. So first is teratogenicity should be explained to the patient. Next is it will cause you dryness, so you should advise the patient to apply moisturizer, as well as there is cheilitis and dryness of lips, you should advise the patient to apply Vaseline over lips. So the cost of the prescription, it will cost you around 3 to 3,500 per prescription, and as there is abscess or cyst, we can also go for some intralesional triamcinolone that can be given as a dose of 2.5 to 5 milligram per ml. The Kenacort that is triamcinolone is in marketed by 10 milligram per ml. So in this case we can dilute with distilled water and you can inject it intralesionally in a concentration of 2.5 to 5 milligram per ml. So now coming to the what is the treatment for grade 4 acne, which is actually abscess, or it can be cyst, or it can lead to extensive post acne scarring. So scarring also various types such as ice pick scar, box scar, rolling scar. So as there has been a lot of damage to the collagen of dermis, so patient ultimately that lead to extensive scarring in patient. So in these cases, what are the things to be done? So first case, if a patient is coming to with so much of extensive scarring, so you shouldn't touch the patient. Better you should refer the patient to dermatologist, because in these patients we generally perform various physical modalities of treatment along with isotretinoin under cover. So it will act better if I are giving isotretinoin along with these physical modalities. What are the physical modalities of acne treatment? So in these cases we are doing either chemical peeling, mostly we do for ice pick scar. In these cases we can do TCA cross, that is trichloroacetic acid. Then we can also do glycolic acid peeling, which is around 20 to 30% glycolic acid peeling, which is actually a superficial peel. Apart from that, we can also do micro needling, which is otherwise called derma roller, and also we can do subcision. So in this subcision, we are just breaking out the adhesive strands which is present in the dermis. So the prescription cost will you around, because we need to do multiple sessions, around 4 to 5 sessions for a case of acne. In each session you need to pay 1,000 rupees, that vary from dermatologist to dermatologist. Now summarizing my whole discussion, as you all get to know that this acne is a chronic, relapsing and remitting disease. First we should rule out the hormonal acne, and for that you also need to carry out the important investigation as we have already discussed. Then other treatment like I told you, like grade 1, grade 2, grade 3, grade 4. Grade 1, grade 2, grade 3 can be treated by you, and grade 4 better for physical modalities of treatment you should refer to dermatologist. Summarize my whole topic, we already have discussed this acne is a chronic, relapsing and remitting course it follows. So we should treat the acne to avoid damage to your dermis, the process of collagenization that can lead up to scarring. So better in this case, in grade 1 acne we already have discussed, we need to give only topical. In grade 2 we have to give oral along with topical. In grade 3 we have to give intralesional steroid along with grade 2 treatment and also photoprotection as you are giving isotretinoin. And in grade 4 we have to follow the physical modalities under the cover of isotretinoin. So apart from that, some people also they complain you the post acne hyperpigmentation. So in this case you can also go for azelaic acid, which is actually an anti-inflammatory property, anti-comedone property, and also it will reduce your pigmentation. But you have to be very patient, because you have to give it for 2 to 3 months to see the results. Along with that, you should the patient should be given sunscreen to prevent further pigmentation. So I think this video will be very informative to you. Thank you so much.